All right, 40 minutes, inshallah. All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you. The whole thing, I love it. Inshallah. So we're at the final day of the convention. How's it going? You guys benefiting, inshallah? Yes. Meeting your inspirational role models? Alhamdulillah. Alhamdulillah. Well, mashallah, like was introduced, today is going to be a difficult conversation, but an important conversation, and it's an open conversation, and it's an honest conversation. Inshallah ta'ala. Before I begin, how many of you were at the morning session? The one I was giving, where I talked a little bit about suicide there as well? All right, inshallah. So here's what we're going to do. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. I'm going to talk about something that's really difficult to talk about. But it is imperative that we actually talk about it. But I'm going to give everybody a trigger warning and tell you, because it's very heavy, and because it might get heavier than even expected, if you need to give yourself time and space to step away, please do so. And when you're ready, feel free to come back. But it is a heavy conversation because the mic's not being used today. It is a heavy conversation because those of us in the mental health field who have been working with the Muslim community for a long time, we've been seeing changes over time. Some of these changes are actually not necessarily new. It's just that we're more alert to them. And in the topic of mental health, would you guys agree that in the last 5 years at least, there's been a lot more conversations around mental health than ever before? Do you remember how in your masajid, and maybe that's still true, in your community centers and other spaces that you're in, they would never really have a topic on mental health and call it mental health? I remember in a time when we wanted to do topics that were very specific, like for example, substance abuse, and we would want to actually call it that, there would be one person to show up in the room. And then they would actually start pulling people from the hallway, like, come on in, come on in. Because it was so taboo and so difficult to talk about that nobody wanted to go in or even be associated with somebody that went into the room to talk about mental health, lest they too be called crazy. SubhanAllah, the tides have shifted. You have actresses and actors, activists, athletes, all types of people that are open and talking about mental health now, and how they're seeking out therapy and support. And they're being open about that journey. And you have, on the other hand, a lot of our religious leaders and imams. I realize it may not be your imam, okay, mashallah. But there are, in fact, those within the religious community that are also standing up and saying, all right, enough is enough. We're going to be open and talk about this. There are even some who are willing to say that they themselves or their family members are going through therapy, and I think that's an amazing change of tides. But here's what I'm going to talk about today. Even with the changes that are happening, there's some real serious stuff, subhanAllah. Not just the mental illnesses that you may hear about that have names, like depression or anxiety, bipolar disorder, schizophrenia, and so on, but also things that maybe don't necessarily have names or you don't know what to call them within yourselves or your loved ones. Just feelings of angst. If anything this pandemic taught us is that all kinds of uncertainties coming with it. When is this going to end? I don't know. Am I really truly, vaccinated enough against Omicron? I don't know. Right? And subhanAllah, there's just so much uncertainty, and that builds in you a sense of anxiety and angst, even if you're not somebody that has clinical anxiety. Right? Isolation, which many of us going into lockdown, out of lockdown, into lockdown, out of lockdown, it's been hard. And the close quarters you've kept with family, and then whoever you live with, roommates and so on, or if you've been completely isolated alone, is also wreaked havoc on ourselves. And so I think finally, the conversation around mental health is finally being had in a more open manner. And you know me, I'm all about, this is not a new story to the Muslims. If you've heard me speak before, you've heard me talk about the history of mental health and the heritage of mental health and how Muslims have always been at the forefront of this discussion. Always. Because in our worldview as Muslims, mind, body, and soul are together. You never separate them out. And because of that, The early Muslims always had treatment centers and healing centers for all kinds of mental health conditions. And they were the first to do what? You guys answer, come on. They were the first to build what? And what are the medicines?
Psychiatric wards.
The hospitals, the healing centers that had what in them? That had in them, yes, mind, body, and soul, but what did they have that was special that no other hospitals in the history of humankind had before the Muslims? Mental health wards, exactly. When you think about how do you have a civilization that the others before, Greeks and Romans and all the rest, couldn't do, what is it about Islam that prompted that? Because there's something, and this is where we're going to talk about when people have that stigma or that shame or I'm not going to go and get help. This is very important to remember, that you all, we all, are part of a heritage that never separated out mind, body, and soul. They were always connected. And because of that, our healing centers and institutions, it's no surprise that they have the mental health within it. I'm talking about talk therapy. Did you know Muslims were some of the first to develop talk therapy? You know the talk therapy that your mama tells you, or your khala, or whoever, tells you, no. We Muslims don't do that. That is a shame to us that somebody would say that Muslims don't do that when the Muslims themselves are the ones who created talk therapy. Come on now, subhanAllah. Sound therapy, music therapy, natural sounds and feelings, emotions with aromatherapy and color and sound, all of it was integrated into these healing centers. Why do I make a big fuss about this? Because I'm tired of the stigma. I'm tired of the shame that surrounds mental health. And I'm tired of people, when they're talking about this topic, calling others like it's an other thing, like it doesn't affect them. They're the ones who are crazy, and don't call me that because I don't have that. The reality is we all have that. You can't have lived through this pandemic and not have something related to mental health, with my all deference and respect to you. Every one of us, if it's not clinically diagnosed, it is there right under the surface. Whether it be a depression or an anxiety or something more serious, it is right under the surface of each and every person. Am I making too bold of a statement? Am I exaggerating? So, the end of the line for mental health, when we worry about people not getting the help they need, either they start to spiral down and things get really tough, right? And they think, I can do this by myself. I'm a mu'min, I'm a believer, I believe in God, I can do this. God's gonna see me through, inshallah, God will see you through. But God also gave you the means to get the help you need. The means, the early Muslims, when they built these institutions that I'm talking about, this wasn't lip service to the Sunnah. This was actually understanding the Sunnah. This was understanding the ahadith that say things like, when Allah sends down an illness, He sends down its cure. Well, if Allah's going to send illnesses like mental illnesses, then clearly He also has for them what? Cures, treatments, professionals, people who know how to help you. This is part of our Sunnah. And the early Muslims had no shame and stigma around this. In fact, they built these amazing, beautiful institutions, fountains, and greenery. We have these papers coming out. I'm not to bore you with our research papers. You can read them, inshallah, on our website at the lab, the Stanford Muslim Mental Health and Islamic Psychology Lab, talking about the talk therapies, the music therapy, the aroma therapies, the gardens, and so on and so forth. Holistic. Holistic. I named the nonprofit that relates to my lab MAS-ICNA after these institutions because it is my dream, inshallah, that we revive the MAS-ICNAs. This is my dream. Inshallah, we're going to do this. We're going to do this. We're actually going to revive this Islamic tradition and heritage where when you get the help you need, it's holistic. It has mind, body, and soul. It has the spirituality, because as Muslims, you don't take that away from us. You've got to keep the Islam in it. You've got to keep the connection to God in it. And honestly, secular psychology has lost its soul. That's not me talking, that's what the literature says. And now the new wave is bring your whole self into therapy. Well, everyone in this room, for you to bring your whole self into therapy, that means bringing all of your identities into therapy. And if you are a Muslim, that's one of your identities. Is that right? So, now I'm going to tell you something that's really difficult. The end of the line, when people do not get help, not only do they're affected themselves, but their family members are too, their loved ones, their friends. It's a ripple effect. You have to realize it's not just you. And when you say, I'm going to rely on myself, I'm going to do this alone, you don't realize that sometimes not only are you harming yourself, but you're also harming the people around you. Because they don't know what to do either. They see you suffering. They want you to be better. And it's affecting them too. So there's a certain part when people say, I'm going to do this to myself. That's selfish. Part of connecting to the broader circles is understanding that you are part of a bigger system. And when we don't get the help we need, the end of the line that I worry about, and the reason we wrote the paper that you just heard about, who published it this summer, and people kept saying, don't publish that, don't publish that. It's going to make the Muslims look bad. Wallahi, even after we published it, I'm telling you, in the highest ranking medical journal, JAMA, which is the Journal of American Medical Association, it is hard to get anything in that journal unless it's like really rigorous and really well studied. Even after it was published there, we had people, imams and different people and so on, and not just imams, even regular people, call it false news, fake news. I'm like, really, people? Really? Have you seen the community lately? MashaAllah. Do you know how to do research? No, anyway, MashaAllah. I love it. But the reality is, it was so hard for people to stomach the results that came out of it. So what were the results? In brief, we compared Muslims to all other faith groups, Christians, Jews, Hindus, Buddhists, and people of no faith, atheists and agnostics. And when we compared suicide attempts, okay, this is where the trigger warning comes in, attempts, we found that Muslims had double, yes, I just said double the rates of suicide attempts from other faith groups or non-faith groups. I didn't expect that. I knew it was high, because I could see it in my practice, and I could see it in all the people that I supervise, and all the cases that are coming through from mental health. I could see it. We knew there was something high, but we didn't know how high. Now, mind you, I didn't say death by suicide, because that's a different category. And alhamdulillah, that's a lot of Muslims are still at the very low end of that. But when you increase attempts, you're going to increase deaths by suicide eventually too. It's going to catch up, and that's the fear. So what do you do? So I'm going to share something with you, because when people hear bad news, they're like, oh no, now what, now what? This lab that we do the research in, and I told you about the nonprofit we started, I am committed, like 110% committed, to making sure that all of our Muslim leaders, our activists, our community and religious leaders are all trained to work on this topic of suicide. It is not easy. I went through entire medical school and psychiatric residency and high-level specialty. I'm a professor at Stanford, subhanAllah, and I didn't know how to deal with this. I had to get extra training in this. So if anybody feels like they know how to do this, even as a mental health professional, they don't. It is specialized training. To talk about suicide prevention, which is all about education. And this is, I want you to know some very important things before we kind of close today with this topic. One, suicide is 100% preventable. There is no other mental health condition that I can tell you about that is 100% preventable. This one is, because it's about education. It's about knowing the signs. It's about intervention. It's about helping. It's about bridging people to care before it gets too late. Now I know there might be people here who have lost loved ones to suicide, and all of my love goes to you. May Allah make it easy for you. And you may be thinking, but how is that prevented? SubhanAllah, I'm not talking about individual cases. Rather, I'm looking into the future and telling you that if there is solid interventions in place and our communities are willing to talk about this very difficult thing and be trained how to appropriately intervene, we can prevent so much. You know what inspires me? There is an ayah in the Quran that you know as well, where Allah subhanahu wa ta'ala says, whoever saves a life, it is though they have saved all of humanity. This is a Muslim-driven mission. It is part and parcel of our Islam. When someone says, no, that's not part of our story, it is. So you know what I want you to do? If you're already on social media, parents get mad at me, they're like, you just told our kids to get on social media. I don't think your kids already are on social media, friends. Mashallah. Mashallah. Anyhow, if you are there, check out the handle. Go to Maristan, at Maristan_org. M-A-R-I-STAN, S-T-A-N. I want you to follow that account specifically because this is where all the trainings and education is coming out. We're putting out, mashallah, every week is coming out all kinds of resources. That handle and also the one for the lab, the Muslim Mental Health and Islamic Psychology lab at Stanford. If you want little kind of knowledge bite-sized pieces around mental health, these are some great accounts to follow because we're constantly taking all that academic research that we're doing and translating into things that all of you can benefit from. We have these articles and we have these little charts of things of like what happens, what to say and what not to say. Wallahi, subhanAllah, sometimes people just get stuck. They want to say something, they want to help someone who's in trouble, or they feel like someone is not doing well, or maybe someone has had a loved one who actually did pass from suicide and they feel stuck, they don't know what to say. And then you worry about saying the wrong thing, and then you don't say anything at all, and it's just like a whole spiral, right? So we have these tips and techniques for you. If you check the website and you follow it, you can download all kinds of resources to help you and your communities. I want you, whatever masjid you come from, whatever community center or organization you're connected to, go to that page, maristan.org, go and download the khutbahs and give it to your MSA khatib, give it to your imams. There's ones that are literally completely written out on suicide prevention, and it follows all the standardized, really rigorous scientific knowledge on how do you talk about suicide, but of course all the fiqh parts of the correct ways of saying the khutbah. Written, the whole thing's written out. There's one on prevention. There's one on postvention, which is what you do in the aftermath. There are resources for you at your fingertips if you know where to go and look at them. So please do. And the last thing I'll say, inshallah, about this topic, is we have a campaign. It launches in just a few days. It's called the 500 Imams campaign that Maristan is launching. You know what the goal is? That no less than 500 Imams, religiously trained women and men, Ustad and Ustadas, are trained in suicide response and certified in it in 2022. Inshallah. The goal, inshallah. The manual that comes with that, we took years of writing, years of research. But it's like a 100-page manual. You can't really give a local leader a manual 100 pages and say, now go do this. So we developed a training. And everything is kind of what we call in medicine and science evidence-based. So we do all this research and make sure it's working. Alhamdulillah, we have all of our IRB and ethics approval, not the boring research stuff that I'm going to bore you with, but just to let you know that this is very sound information. But you know what's special about it? Every resource that I looked at on the topic of suicide was either too secular, so when you tried to give it to the religious leaders, it didn't really work. And on the other hand, there were other resources, but they weren't scientifically rigorous enough. They weren't accurate. So we took the two and kind of married them together. So now these imams and community leaders and youth leaders and MSA leaders and so on, they realize that the training that they're getting is something that speaks directly to them. What do I do at the janazah prayer? Do I make dua for this person? How do I help the person, the family that's left behind, and so on and so forth? All of this is dealt with in the training, and it's a certificate training. And all of you can eventually take this as well because we hope to make it virtual, inshallah ta'ala. If there's anyone here who's interested in kind of supporting this and kind of making sure that it comes to your communities, let us know. You go to maristan.org and kind of let us know, come talk to us in there or through our DMs and our social media. But here's what I want to tell you. The last study that came out about how many Muslim centers are there in America, do you know how many there are? How many masajid do we have in America? A lot. I love it. Give me a number.
3,000.
You're very close. 2,500 is really close.
3,000.
It's about 3,000. 3,000 masajid in America. You know what my 5-year plan for Maristan is? I want all 3,000 masajid trained. And with that, inshallah, I'm turning it over to Linda, inshallah. But we'll keep on this conversation going because we need to have these conversations going. We need them to be open, but I'll tell you what else we need them to be. We need them to be grounded in accurate knowledge. This is where the researcher and professor and Dr. Ali comes out, okay? But we also need it to be grounded in actual Islamic information. And this is where my Sharia training comes out. You gotta put the two together in order for it to actually work for our communities. So may Allah bless you. May this come as ease and help to your communities, inshallah. And please do make dua and support the missions, because these are not easy. Trust me, it is not easy to roll out mental health work or to even get it funded. But please, inshallah, with your duas and support, because we, like the ayah says, we need to save even the one life. You've saved like all of humanity in Allah subhanahu wa ta'ala's eyes. Barakallahu feekum wa sallallahu alayhi wa sallam.
Let's give it up one more time to Dr. Rania. We need about 1,000 more Dr. Ranias. So for all of you,
they're all coming, inshallah.
yeah, for all of you who are, high school age or in college, I need some major changes because this is an extremely important topic to me. You're probably wondering to yourself, okay, so this is a whole topic about mental health. Why is Sister Linda here? We know she's an activist. This doesn't kind of make sense, so I came here because I'm really curious. And I am not a mental health specialist, but after the horrific attacks of 9/11 that you all know happened, many of you were not born, some of you were very young when it happened. We had absolutely zero Arabic-speaking mental health professionals in the New York City area. And so many of us had to go through training in order to be able to provide services to our community, and I was one of those people. And so for 6 years, many people don't know this, I worked at a hospital in New York City called Lutheran Medical Center, and I was providing family counseling as someone who did not have a degree in mental health services. That's the need is there. But what I'm really here to talk to you all about is I'm just gonna be real, and I'm gonna be personal. And I'm gonna say also, Dr. Rania thought she was telling you, things that came off maybe controversial or maybe made you uncomfortable. And that's my job in the Muslim community. I'm going to make you uncomfortable. Because people don't change, communities don't change, nothing changes unless you are uncomfortable. So when you're sleeping at night and you're in the right exact position, you don't move from that position because you are comfortable. You're sitting on a chair right now and you feel comfortable, you don't move when you're comfortable. But if wherever you are is uncomfortable, it makes you move, it makes you shift. And that's what we have to do around this issue of mental health services. Sisters and brothers, we go through so much pressure in the world that we live in today. Many of us are children of immigrants, grandchildren of immigrants, and believe it or not, I'm almost gonna be 42 years old. You know what I sit up and think about sometimes? I think about, did I make my parents' journey from living under a military occupation in Palestine? Am I worth it? Did I make that journey worth it for them? Am I enough for my parents? We have the pressures of school. Our parents came, some of them don't have the same level of education as we do, didn't have the same opportunities that we do. And we every day are struggling. We want to do good, we want to make our parents proud. We want to have more and show them that we could do more than they could, and try to honor them for all the sacrifices that they have made for us. We have an economy where we can barely afford the places that we live sometimes, where we're trying to make it. Some of us Allah has blessed and others Allah has not blessed in the same ways from this perspective. So there are people in our communities that are literally living paycheck to paycheck, maybe even sometimes not having dinner at the table to feed their children. Then we live in a community where our brothers and sisters in places like Syria and Yemen and others are coming here as refugees. Some people who Allah had blessed so much, and in 1 minute, it's gone. Then they come here to have to hustle and struggle. The same struggles many of us experience, but times 10. Sometimes I think about myself as an activist in the Muslim community. Sometimes I'm not Muslim enough for people. Sometimes I'm too Muslim for some people. Sometimes I'm too Palestinian for some people. Sometimes I'm not Palestinian enough for other people. Sisters and brothers, the criticism, that's what we do really good at, criticism in the Muslim community. MashaAllah. MashaAllah. Wow. Everybody's a perfectionist in the Muslim community. Everybody knows everything. And so a lot of times, even in whether you're an MSA leader, whether you're trying to organize in your community, whether you're affiliated with an organization, the people sitting down doing nothing have everything to say about what you're doing. That's the story of Linda Sarsour's life in the Muslim America. I say, listen, if you got a better way, show me the way, and I'll be with you over here. We, sisters and brothers, are also putting a lot of pressure on each other, but we also, without the context of mental health. So for example, sometimes you're feeling sad. I feel sad all the time. Sometimes I'm trying to figure out what is the thing that is making me sad? What's the thing that happened around me that's making, I don't know why I'm sad. And then your parents see you and you're like sleeping in, or you're sleeping too much, or you don't have a lot of motivation, and then your parents start telling you, look at you, you have everything. You have a house, I feed you, you have nice clothes, I let you go to your friend's house. You have everything. How could you be sad? How could you not have motivation? How could you not be doing well in school? All this that I did for you, and look at you, you could only get a B+. I put you in college to get A+, not B+. This is what our parents do. And I'm saying that with all the love that I have in my heart for parents, because I am a parent too. I have a 22-year-old son, a 21-year-old daughter, and a 17-year-old daughter. One of the things that I decided in my life, what I decided based on my own experiences, is I was not going to put that kind of pressure on my children. I don't tell my kids, you better get an A+. I tell my kids, do the best that you can. Do the best that you can. Do the best that you can. I don't tell my kids I feed you and I house you and I clothe you. Guess what? My kids didn't ask to be here. And for the parents in the room, it is your responsibility to feed your kids and make sure that they have everything that they need. These types of conversations is what take our kids and make that relationship that we have and that gap between us farther and farther away. Our children didn't ask to be born. It is your responsibility to ensure they have. And it's also your responsibility as parents to say to the kids, how are you doing? Imagine how simple, sisters and brothers, that is. Every once in a while to be at a dinner table with your child or see your kid watching some television and say, how are you doing today? How are you feeling? Just having we're always about, tomorrow you gotta go to this, tomorrow's halakha, on Friday, uncle and auntie so-and-so is coming to the house, clean your room, go do this. This is not gonna work. Of course, the young people have a responsibility to respect their parents, to do the things that they know they're responsible for, taking care of their own headquarters and where they are, and all these basic things. But we aren't, as parents, have to understand that we live in a country that every day tells our kids, you don't belong here. That's right. That tells our kids, you're not American enough. Sometimes they go into the Muslim community tells them they're not Muslim enough. This sister's hijab is not right, this one doesn't wear hijab, this one's pants is too tight, this one's shirt. This is what we do in the Muslim community. We have to find a way, sisters and brothers, that everything we oppose on the outside of our community, we can't be practicing in the Muslim community. It doesn't make sense. It doesn't make sense. If your child comes to you and says, Baba, I know that you are an engineer, and I love you for being an engineer, and you are the best engineer in the world, but I want to be a news broadcaster. Baba, I want to be a journalist. I want to tell Muslim stories. Allowing our children to explore a world and allow them to be who it is they want to be. And oftentimes when you hear a lot of these stories, and you know many of these stories, one of the biggest concerns, that's something else that we're going to talk about next year, there's an opioid crisis in our community. How many people here know somebody that died of an overdose of pills somewhere in this country? I know too many to count here. In New York, in Dearborn, in Chicago, mostly young men from between ages 16 to 24. Why do you think a young man who has his whole future ahead of him, has everything, has every opportunity available to them, why would they think to themselves, this is the way that I want to go? You know why? Because when people are on opioids, it numbs them on the inside. It takes you out of the reality of the world and the stresses that we have to experience every day. Why are you 25 and not married? Why is sister so-and-so now on her 3rd master's degree, she doesn't have a husband? When Allah wants to give them nasib and give them a husband, that nasib comes. It doesn't come from you. It's not how the world works, sisters and brothers. And so oftentimes I say to people, we gotta get back to our Islamic practices. Then we go to the masajid and we go into different spaces and you hear people say, oh, Allah is the most compassionate, right? Allah is the most merciful. Do we say that or not? Is that not true or not? Are these not part of the 99 names of our beloved Lord? Sisters and brothers, how could you say Allah is the most merciful? And Allah is the most kind? And Allah is the most compassionate? And then you are not merciful, and you are not compassionate, and you are not kind. How does that make sense? In the Muslim community, we do a lot of preaching that we don't practice. And then we say, where are the kids in the masjid today? Imams tell me, oh, Sister Linda, come over. Where are the women? Why there's not a lot of women that come to the masjid? Oh, Sister Linda, wallahi, we have to think about programs because we need young people in the masjid. It's not about programs. It's about, do you see these young people? Are you speaking to them about things that are relevant to them? I go to the masjid, the sheikh is like, al-mawadda wal-rahmah, telling me about marriage and stuff. The kids, you want the 16-year-olds? That's not what they want to hear. We got that. That mawadda and rahmah khutbah needs to be retired. We get it. It's great. It's the easiest one to remember. We got to move on from that. Our kids are living in a real world full of racism, of bigotry, women who are experiencing sexism inside and outside of our Muslim community. We are living in a world where we are in a global pandemic, where people have been downsized from their companies, people have lost jobs, people went from being part of their college campus with their friends to doing Zooms in their bedrooms in their pajamas. The world has changed. And the thing about our Muslim community is we have to evolve with the times. And if we want to stay connected to somebody, you gotta be relevant to those folks, right? So whether you're trying to bring women in the masjid, you want the women in the masjid? How about you let us come in through the same door and not make me go around the garbage cans? How about taking me out of the basement? How about that? Guess what? I'll go to your masjid. If your masjid doesn't make me sit in the basement and allows me to be in the musalla where I don't have to watch an imam on a television because I could just do that at home, that makes me feel respected. That tells me that this is a mosque that sees all of me, that respects and values my presence. And so oftentimes I'm walking around and I'm wondering to myself, am I valued? Does somebody see me? And that's the question that a lot of our young people ask, young women, older women in our community, do you see me? Do you see my value? Another thing I'm gonna, just because about the masjid thing, because this really bothers me, I just want to put it on the record just in case an imam watches this. You go to Taraweeh in Ramadan, or the Friday prayer. You're a mom. You should have access to the house of God too. So what does the imam do? He starts yelling and screaming on the mic, talk about leave your kids at home, don't bring the kids, you can't leave your kids at home, stay in the house. What? I love on the day that those imams leave their Lord, and the Lord says, why did those women leave the mosque? And he says, oh yeah, about that. What I meant to say was, we have a responsibility in our community to, and I hope through the training that Dr. Rania will do and her team, is to really, this idea of belonging. Some mental health, some of it is chemical imbalance. It's something that you can't do nothing about, and I want to be clear about that. Because it's actually a medical diagnosis. Sometimes it's also just sense of belonging, sense of being valued in its space, sense of somebody just saying, I see the sister, and I see her struggle, and I see what she's trying to do. My daughter today, my sister actually has my phone in the back. My daughter today sent me her grades. She's in her 4th year of college. And she's like, this is my transcript or whatever. And I'm running around and hustling, and I stopped, I looked at my phone, and I looked at my daughter's grade. She had all A's, 1 B. And I said, I am so proud of you. No questions asked, I don't want to know about the details. I am so proud of you. The one thing that I have noticed, especially because I work with a lot of young people in the Muslim community, that they tell me sometimes, and I know that the parents, and I just want to be clear, your parents love you, right? And they care about you, and they want the best for you. But we also, some of us come from this is not Islamic, this is from the cultures that we come from. So let's make a distinction here. South Asian, Arab, West Africans, East Africans, you're all in it too. Let me just keep it here, because your parents be hard too, let me tell you. We don't do the basic, simple things like, I'm proud of you. Mama, I love you. Ask yourself this question. How many times in the last week have you actually told your child, I love you? And it could be in your own language. Don't make, whatever, however you say it. I've actually done this with parents, and parents will tell me I've done sister halakas, and a sister one time told me, and she was crying the whole time. And she said, Sister Linda, I don't remember the last time, just 5 daughters. She said, I don't remember the last time that I actually verbally told my daughters that I love them. We cook for our kids, we iron their clothes, we clean for them, we give them everything that they want, we give them money, we do what we take them to the doctor, we make sure they have health care and health insurance. And those are all acts of love. That's love. But sometimes your child just wants you to say, I love you. That's it. It's very important, sisters and brothers. I'm telling you, when that sister told me that I can't remember the last time I told my kids that I love them, my heart was broken for her. Because it actually feels good when you tell your child that you love them, and then your child has to verbalize to you that they love you too. That brings you closer together. So let's just take that with us and go. I'm going to say to you all that we've all also experienced loss, and I know that you had a different session earlier today when you talked about this. This past couple of weeks ago was the 1-year anniversary of 3 people that I love very much that died. One of them was a young man named Hamza Negdi from Louisville, Kentucky. He was a young boy, Egyptian Muslim boy, who was an organizer. And he was organizing, many of you know I moved to Louisville, Kentucky for 4 months last year to organize on the case of Rania Taylor, who was murdered by the Louisville Metro Police Department. And when I got there and I started organizing, everybody was black except me. But then I found another one. And he was a young Egyptian boy, and his name was Hamza, but everybody in the square knew him as Travis. Everyone was like, Travis, Travis, Travis. But us, especially Arab, I know Arab when I see him. It's like a thing. And so I went up to him one day, and I was like, oh, hey, how you doing, whatever. We kind of introduced myself to him, and he finally told me, he said, Sister Linda, he said, Travis is not my real name. My real name is Hamza, and his name is Hamza Negdi, and he's an Egyptian Muslim boy. This is a boy, sisters and brothers, who many years ago went to foster care. His father was physically abusive to his mother. And then circumstances led the city to take the children from their parents. And so this child spent his pretty much entire, from when he was a little boy, when he used to go to, I have pictures of him when he used to go to the masjid as a little boy. And then he went and became a child of the system, in the foster care system. And when he was 18 years old, he aged out of the foster care system and he just went into the street. They just say, okay, 18 years old is done from here, put him out into the street. And so around the Breonna Taylor stuff, he found a lot of these kids who were aging out of foster care, found kind of like a family in what they called Breonna Square, which is a park. And all these older women would cook in the park, and all these kids who aged out of foster care were in the park. Me and Hamza connected immediately. I was Arab American, he was Arab American, I was an organizer, he was an organizer, we were both organized in the Black Lives Matter movement, and we got really, really close, and especially because I knew his father's actually in prison today. And he was shot and killed in Louisville, Kentucky. And that's another thing, sisters and brothers, we don't know. I could walk out of here today. Allahu A'lam. Allah decides when we go. No one else gets to decide for you when your last day on this earth. Allah decided that was going to be Hamza's last day, and he was shot and killed in a carjacking. I was devastated because this kid had so much promise, and he would have still text messages between me and him where he kept telling me, nobody ever saw me. I didn't think anybody even knew that I was in the square. And it was only because I would call him and say, how are you doing? Did you eat today? What's going on? Come to the house, because we had rented a house. And because he was in foster care, going from house to house and house to house and system to system, finally he found someone that was like, I see you. Then, many of you know this great man who is a big proponent of mental health services. He was actually a champion in New York. at Columbia. And he was an OBGYN doctor, Dr. Ahmed Jabir. Dr. Ahmed Jabir was the founder of the Arab American Association of New York, where many of you know I spent 15 years as executive director. He passed away. December 10th was his 1 year anniversary. Sisters and brothers, I was devastated. He was like a father to me. He was my mentor. He was someone that, as a Muslim woman in the community, when everybody else was telling me I was too loud, I was too, putting my hands in everything, not minding my business, which is what they used to say about me 21 years ago when I started organizing. They still say I don't mind my business today, but they got a little bit better, at voicing that out loud. He was like, absolutely not. This is our leader, and gave me those platforms. And I say to you, if you are, and there are some in the room, if you are in a place of leadership, especially our brothers, giving space to sisters is really important. So I lost someone who really is the reason why I am who I am today. And Allah yarhameh and yarham Travis, AKA Hamza. I also lost my cousin. My cousin's 34 years old, father of 2. In 3 weeks, I lost Hamza, I lost my first cousin, his name is Muhammad, and then I lost Dr. Jabir. Sisters and brothers, I didn't want to get out of bed. I said, you know what, that's it. I've done my part. I can't move. I can't even work. I don't have no motivation. Sometimes we need to take a break. Sometimes you have to say, I'm just gonna walk away for a little bit. And then you feel pressure and say, if I walk away, then what happens to this, and what happens to that, and what happens to that? And moms do that all the time. Who's gonna cook, who's gonna do the laundry? This is the kind of community we have to build where a mom can say, you know what, I got it. Because my sister-in-law is gonna come do the laundry. And then my daughter is gonna do the cooking. We need to build that sense of community even when inside of the family. And to share with you even just deeper than that, so I went through a lot of grief in the last few weeks, and many of you have probably noticed that my demeanor is just a lot more, a little more dark, I guess you could say. Sisters and brothers, these past 5 years have been the darkest years of my life, literally. I've experienced severe anxiety and panic attacks to the point where I've been hospitalized. I've experienced severe depression. You all know, I've been through a lot. Zionists, right-wing Zionists, Islamophobes, the son of the President of the United States. I mean, I was getting it from everywhere. I would wake up in the morning and I would feel like it was me versus the whole world. And to be honest with you, yes, did I have some people in the Muslim community who supported me? Absolutely. But did I feel like my community had my back? When people are threatening to kill me, kill my children, I had to pay for my own security. I have to make sure that my family's safe because they didn't ask for me. And so there were times in the Muslim community where I was like, do these people see me? Am I valued? Is what I'm doing even something that means something to somebody? And I'm not saying that that's the truth. I'm saying that that was what my mind was telling me. So here I am, isolated, feeling like I'm in a corner all by myself and just asking myself all these questions out loud. Am I alone? Am I doing this alone? And even the book that I wrote, Sisters and Brothers, I'm going to end with this, and I'm going to say this to all of you. Sister Linda is not a lady that got time to write books. I don't have time to write a book. You know why I wrote a book? For 2 reasons. Number one, I was worried that one day I was going to get assassinated, and the only legacy that I have is all the headlines that you've all read about me online. All the bad things that the Islamophobes said about me, that someone was going to carry my story without me, and I was like, that absolutely was not going to happen. So if that means it was going to take me 3 years to write a book, I was going to write that book to make sure that at least if I was no longer here on this earth, that my great-grandchildren were going to have a story that is of resilience, of pride, and to remind them that I, their great-grandmother, was unapologetically Muslim and that I fought for our community with every single thing that I had. And that was the first thing. I wrote that book, I was working through trauma. I had to write it down. I had to also remind myself where I came from. All of us got a story, and my book was an opportunity to say, I am a proud daughter of Palestinian immigrants. I also struggled as a daughter who was the oldest of 7 children. I was someone who also had all the pressures of the world. I was like my parents' guinea pig. I was the one that was supposed to do all the things right. I had to get married when I was 17. I had to bring the first grandbabies. I had to go to school. I had to be the role model for people in my family. I had to do all the things. And that was my life. My life was living for everybody else. And my activism life is me living for myself, doing the things that are purposeful to me. But that also came with grave consequences. And that put me, and it made me experience a lot of trauma. Many of you who haven't read my book, I was in a car accident in 2005, where my mentor died in the car accident in a car that I was driving. I never told anybody about that. Only the people in our community who knew me, like in Brooklyn, my family, my immediate, nobody knew. I went through trauma. I never went to to therapy, because that wasn't something that was encouraged. That wasn't something that I had access to in our Muslim community. So here I was, I watched a woman many people in this room know who literally died right before my very eyes. And I was the driver of that car. Do you not think that for years I lived with guilt after that? That I left the woman who was already a single mother and left her